BPH is a prostate issue affecting more than 40 million men in the U.S. If left untreated, the condition can cause permanent damage. Here to discuss treatment options and bring awareness to BPH for Men's Health Month is Dr. David Sussman. Welcome, doctor.
Thank you.
I'm happy to have you here. So tell us, what exactly is BPH and what are some of the common symptoms?
Sure. Well, BPH is a benign or non-cancerous enlargement of the prostate gland. The prostate gland sits at the base of the bladder, between the bladder and the urethra tube through which you pass your urine. As the prostate enlarges, typically with age, the flow of urine is obstructed to some degree. This leads to a decreased urinary flow, leads to frequency of urination, hesitancy, and often nighttime urination. Quite bothersome symptoms.
So what are some of the misconceptions about BPH?
That's a good question. I think one of the problems that we all face, is certainly in my field, which takes care of a lot of men, is that if you go to see the urologist about your urinary symptoms, either you'll get a pill to take forever with all kinds of side effects to treat your symptoms, or you'll have a hospital-based kind of invasive procedure to treat your prostate, to remove the prostate tissue with a lot of sexual side effects. What we're encouraging men is to talk to their family doctors and then to get to the urologist to talk about their urinary symptoms. There's some new technology that's available, really a revolutionary way to treat prostate symptoms, easy to do in office or outpatient setting, minimally invasive, back to activities quickly, and no sexual side effects.
So a lot of new treatments and techniques. I know one of them is the UroLift system. What exactly is that and how can that help?
So UroLift, it really is a new technology. We've been using it in the U.S. for about 4 to 5 years. And essentially, it pulls the prostate tissue apart, thereby relieving the obstruction that it caused and lessening the symptoms. So men can get back to their normal activities more quickly. They have better flow, typically less nighttime urination, less hesitancy. And the nice thing about it is, as I mentioned, no sexual side effects, good durability. There's now 5-year data to show that 85% of men at 5 years are still doing well with the procedure. So I think these are the kind of technologies that we need to talk to our patients about so they understand and not be afraid to come out and talk to us so that we can help them with their symptoms.
It really makes sense because I think a lot of men are afraid just to even talk to the doctor about it. Why is treatment of BPH so important? Why not just keep it to yourself? Because I feel like a lot of men do that.
They do, and I think there's a couple reasons. They're afraid of what we're going to offer them. They're also anxious about any kind of discussion about their genitourinary system because, as you know, men get worried about their sexual function. But the thing that they have to remember is sometimes it's just symptomatic problems, but BPH can also lead to incomplete bladder emptying, urinary infections, kidney problems. So there's more to the story than just the urinary symptoms themselves, and it's why we're really trying to encourage patients to ask questions. A lot of times it's the wives that encourage men to see a physician. But either way, talk to the urologist. This is what we do, and we can really help to enlighten them about what's out there to help them with their symptoms.
All right, Dr. Sussman, we should just go to urolift.com, is that correct, to get more information?
It is, and it has a lot of information about BPH in general. There's a short quiz that you can take about urinary symptoms, and there's a physician finder to find out who in the area is doing the UroLift procedure.
All right, Dr. Sussman, thank you so much for this important information, and we'll be right back with more Midday Maryland right after this. Stay tuned.